But Father, I was going to ask, precisely to your point, even if it were mild, but you have more transmissibility and therefore more people having it. Yes, mild symptoms, you're not getting to moderate or severe, but knowing how many people handle a positive test, right? Wouldn't you still run the risk of overwhelming hospitals, even if you were overwhelming them with mild cases?
Well, yeah, I mean, you can see in South Africa that most of the patients are mild. Yes, that would but that is a triaging issue. That is an issue that will have to be dealt with at the level of the hospital. And that can be dealt with, right? So you have to, if you are aware that Omicron is now the dominant variant, then you can look out to triage patients that are mild as compared to those who are at risk for moderate or severe disease. Also, this is the reason why I emphasize the antivirals in my briefing of the president. At some point, we need to move to, there will be future variants. So this is going to be a lifelong scenario that we are facing today. And so we have to begin to transition to an endemic consideration for COVID-19. And what that means now is really, accelerating the approval for molnupiravir for compassionate use in the Philippines, trying to obtain Paxlovid, even though there is still a shortage of that drug, and then begin to allow our medical professionals to triage our patients, to send them home. And you say, you are at risk, but we're going to send you home with 10 pills, and you must take 2 pills every day, 1 in the morning, 1 in the evening for 5 days, and we will not see you again. And that you're correct. There's going to be, especially in the Philippines, I think, unlike here in the US, it's in the hospital, out of the hospital. Basically, you have major surgery, they send you home tomorrow. But in the Philippines, confinement is a serious thing. They tend to be longer. But our healthcare professionals will have to adjust so that they will be able to properly manage our limited healthcare infrastructure resources with the authentic needs of our kababayans.
Father, maybe you can explain more what endemic means.
Yes.
I think that part of your presentation last night was applauded by the cabinet and the president, and you were even asked to pray afterwards. They loved your presentation. What can people do under an endemic environment when the coronavirus becomes endemic? Can we take off our mask? Can we travel again on planes without masks?
So flu is endemic.
Will it be like the flu? Yes.
It will be like flu, right? So flu is endemic. So if you want to ask, what will life be like post-pandemic COVID? Yes. Look at flu, right? So flu is an endemic disease. You will see it still kills Filipinos, diba? So it will kill our elderly, those who have comorbidities. But what you're seeing here is that the levels of death, even though tragic, is not overwhelming the health infrastructure. So if you're asking me, what distinguishes pandemic versus endemic, it is the pressure on the healthcare system. So our pandemic is a pandemic because when we have a wave, the hospitals are overwhelmed everywhere. And our healthcare workers are exhausted and burnt out and devastated. They are not burnt out and devastated by flu. Right? There will be a regular cases of flu. You will vaccinate against flu. Some will not vaccinate. They will go into the hospital. This is what we imagine is going to happen with COVID. Now, we do not wear masks against flu unless we have flu, right? So unless you have flu, you are at home. And if you go out, now I think one of the things that's going to change is you will see people are going to be more mask friendly when they are sick. In a way that they were not. This is the culture really of some of our Northern Asian cultures, Japan, Taiwan. They will wear masks if they're sick. And I think what you're going to see is there will be a transformation in societies around the world. Filipinos will be they're not so scared of masks anymore, but there will not be mask mandates. There will certainly not be face shield mandates. There will be face-to-face. Everything will be face-to-face. You will simply stay at home. my prayer is by next Christmas, this is where we will be.
Father,
Yeah, I was
Father,
going
on the
to
other
ask
side of
you,
that,
okay, timeline-wise, what are we talking about here? If we were to continue with the protocols the way they are now, and the way we're seeing, the curve of COVID cases, what timeline are we looking at medically?
So again, everything is dependent on appearance of a new variant, right? A new variant always changes the picture. But given what we have now, if we can sustain our vaccination rates, if we can sustain our boosting, if we can obtain enough or at least some antivirals, we will be able to return to pretty much endemic levels. Hopefully by next summer, hopefully certainly my
Wow.
prayer is by next Christmas, huh?
Wow. Summer's good.
Summer is good. Remember, summer, what has to happen for a summer is we will see these very low levels for the next 3 or 4 months. If we see ADAR below 1 in 100,000 for the next few months, if we can maintain this, and what will happen is mobility will slowly increase, and we will see if we can maintain this, and we will continue to vaccinate, we will continue to boost. Our people will, there will be breakthroughs. You will see that there will be spikes, but there will be spikes, but not the kind of waves that we've seen.
Yes.
And they will completely dive. If that is the case, my university here, we have 96% vaccination coverage. We have cases. They come in, we wear masks in class, but everywhere else there's no mask. And if you are in the same room, but within 6 feet, everyone can take off the mask, even if you're not eating. And we have no waves. We have not had a wave for 4 months.